Dr. Pravin Mehta is originally from Uganda. He did his medical training in Sheffield, England, ultimately arriving in Winnipeg in 1972. While Dr. Mehta is a family practitioner, he feels a strong connection to the specialty area of gerontology. He is particularly dedicated to ensuring that all family medicine residents get sufficient training in caring for the elderly.
Unfortunately, the medical students that train right now and the family medicine residents probably don't get as much exposure to the care of the elderly as they should, and that's where my passion is, to make sure that that happens as we go along.
Dr. Mehta explained that when physicians care for the elderly, they need to work collaboratively with pharmacists, nurses, social workers, psychologists, and mental health workers as a team.
This is Sarah.
Hi.
She's our pharmacist.
Nice to meet you.
Hi.
Diane, have you met her before?
No, I haven't.
Nice to meet you.
Nice to meet
She's
you.
the one who makes sure that we give you the right pills for your pain. Doing a lot of things like virtual practices, making house calls, having geriatric program assessment teams, day hospitals, that help us as family doctors not to get overwhelmed with trying to fix everything ourselves, but using the community resources in a timely fashion and in a team ways by communication, so that the person gets the best care.
He's a gentleman with Parkinson's, end-stage dementia, and he has tube feeds. We keep in touch with his family, who come in sporadically.
He stresses that working with the patient's family is a top priority.
Families are the most important, right? Because I think that is so important, because I always tell my patients that they need to keep their connections. They cannot break them off, because if you're isolated, you'll not get the best care. They are their advocates, and you need to get collateral information from the family members, and they actually know better what needs to be done for the patient or whoever you're looking after.
I'll give her the 200 in the morning, then 100 at lunchtime and 100 at bedtime, because she's sleeping okay. So we'll see if that helps the pain, and then I can reassess it.
One thing family doctors must be aware of are the community resources available, from home care to assisted living to long-term and chronic care facilities. Dr. Mehta is the medical director at Taché Nursing Home and has been since shortly after his arrival in Winnipeg in the late 70s. Taché now has 11 English and French-speaking physicians, and each take care of 40 to 50 residents. Training new doctors in the unique needs and unique rewards of caring for the elderly is a priority for Dr. Mehta.
So as long as we keep training, keep interest alive in younger generation to take care of the elderly, and I think we're doing a better job now, I think that it won't be so difficult. And I think that there is more interest in people wanting to do family medicine now. Not only because it's a good thing to do, but the College of Family Physicians is also promoting it in the right way. At the same time, I feel very proud with Doctors Manitoba that they've done a fantastic job of working with the government, who's also been very supportive in this initiative.
Dr. Mehta feels that being a family physician and providing a continuity of care to his patients over many years is exceptionally rewarding.
It's building relationships, and your patients actually become your friends. They become part of your family, and it's over a period of time, and you get to know them so well, and you're hoping that you're doing things that's solving their problems successfully, and you also feel appreciated that you've done a good job, and when you get a nice little card saying thank you for doing whatever you did, that's very rewarding to me.